studying mentorship, I'm studying sports physical therapy. So before I get started talking about my original work, I want to do a little activity with y'all. I've been researching what Fox News accounts as the 10 most common sports injuries seen throughout America. So if you've experienced one of these injuries, will you please stand for me? So as you can see, there are many of you. Would anyone like to share what their injury was and how they contracted it? Yes?
I had the Achilles tendonitis. I was playing in a tennis tournament and I had some irritation before I started, and by the time I got to the semifinals, it forced me to quit.
Okay. So as you can see, sports injuries do kind of take over athleticism in sports, and you'll only sit down. So the objective for my original work this year was to establish the common sports injuries we see in America. Not just what Fox News accounts as the top 10, but any extras that we might see along the way, as well as establish patterns within different age groups, different sports, as well as different regions throughout the United States. I also wanted to gather credible research that could be used to educate our athletes and help them prevent injuries in their future sports careers, as well as establish a base for my final product. The fundamentals I had was the who. I surveyed 45 physical therapists from all over the United States from different regions. I had some up in the Northeast, some down in the Southwest, a few from Alaska and Hawaii, which was pretty cool to see. I also conducted all my research in the month of this past January through a survey on Google Forms asking for the physical therapists city and state, what age groups they typically work with, how long they've been in the physical therapy career, what injuries they feel are most prevalent among athletes, if there are any common relationships between different sports injuries and different sports, and if so, what would these injuries be with their counterpart sport? So the first question I asked was what age groups they typically work with, and I saw that the majority of my physical therapists work with ranges of 10 to 80, which is about the majority of our population here in the United States. So it makes sense that they would work with these age groups. I also asked them what age groups they see the most sports-related injuries within. And now this is a big deal considering our adolescents, as you can see from above, they had the highest rating number of sports injuries throughout all of my physical therapists. But also I found that sports injuries were prevalent among people up until the age of 40, which was when there's about a drop-off. The next is that I asked them what sports injuries of these top 10 were the most common, and these are what Fox News again accredits as the top 10 sports injuries you see in America, and I feel like some of these should have been left off their list, especially groin strain, which only had 5 votes out of 45 from my physical therapist, and tennis and golf elbow, which had about 10 votes. But some of these were definitely common, such as the ankle sprain as well as the shoulder injuries. So I had an other category for them to insert their own answers, and I found that almost more than half of my physical therapists agreed that ACL, MCL, LCL, and other ligament damages were extremely common throughout all sports players, as well as many overuse-related injuries. Now, overuse-related injury is kind of a broad topic. It can affect any part of your body where you're exerting stress over and over again. This is a long-lasting process, and so there was many overuse-related injuries. But I also saw a high number of rotator cuff and bicep injuries, which makes sense because your shoulder joint is actually one of the weakest joints in the body. It has the least reinforcement, so it does make sense that they would be contracting high rates of shoulder injuries. I tallied up some of the sports that had the most sports-related injuries within them, and I kind of narrowed it down to about 4 different sports, one of them being football. Football is America's favorite pastime, and unfortunately, football had the highest rate of concussions in any other injury and any other sport in their group, as well as many ankle and knee sprains and strains, pulled muscles, shoulder injury and dislocations, ACL and meniscus injury, as well as back pain. And unfortunately, football, we do reinforce with many pads and helmets, but it is not fully protecting our athletes from different injuries. I also found that soccer had a very high rate of injuries, one of them being the ACL and meniscus tears, due to the starting-stopping nature of the sport. You're often faced with components and competitors running into each other, and when the knee stops and rotates inward, that's when we see the majority of the ACL tears. Unfortunately, ACL tears are typically a surgical matter, and they do require extensive periods of rehabilitation, so that's unfortunate. However, there are many pulled muscles, ankle and knee sprains and strains, shin splints, groin injuries, as well as hamstring sprains found throughout the sport of soccer. My next sport that I found a high number of injuries in was gymnastics, which is a highly competitive sport in which gymnasts have unnatural amounts of force placed on their limbs when they're doing somersaults or back handsprings, things of that nature. And this does cause many ankle fractures and injuries, elbow fractures, wrist pain, ACL tears, shoulder dislocation and injury, back pain, foot Achilles, and knee tendinitis. So as you can see, their injuries are all over the board. They're head to toe, not certainly affecting your upper extremities or your lower extremities. It's really just all over. Next, I found that running sports such as track and cross country had an extremely high rate, probably one of the highest out of all the sports as far as injuries go. But as you can see, the majority of these track and cross country players' injuries affect your lower extremities, which is where mostly the running happens. These could be with knee injury, hip pain, ACL meniscus tears, ankle and knee sprains and strains, patellofemoral pain, plantar fasciitis, Achilles tendinitis, and IT band injury, which is your outer thigh. Some observations I made throughout my research was that there were traumatic injuries, which would be examples of ACL, meniscal, and ligament tears, shoulder dislocations, fractures, and concussions. Unfortunately, with our traumatic injuries, you can't really see them coming. You can't say, you're going to get a concussion during your football game, go put on extra helmets. So there's really no way of preventing them through different warm-ups, things of that. So there were high rates of overuse injuries, which could have been prevented, such as shin splints, pulled muscles, sprains and strains, as well as tendinitis. And these typically have a longer onset period, but can be totally prevented through different warm-up mechanisms as well as conditioning and weight bearing. There were patterns within my sports injuries, and I didn't find any logical, but I did put an example of that up there. So we'll talk about the logical for a minute. Baseball players with rotator cuff injuries would be a good example of logical, because baseball players are exerting a large amount of force onto their back and shoulders, and I found that my baseball players actually had the highest rate of the rotator cuff injuries out of all my other sports. But an illogical pattern would be something like swimmers and plantar fasciitis, which is pain at the bottom of your heel and toe. And this wouldn't make any sense because swimmers are in the water and not on land. But my swimmers actually did have a high rate of back pain and shoulder injury, which makes sense because they're exerting more force on their upper extremities. So I asked my physical therapist to decide if our younger population or our older population faces the most sports injuries. And what I found was interesting because they kind of divided amongst each other and went half and half. So I'll talk about my age group of 30 and under for a little bit. These were mostly traumatic injuries in which the sports players typically play in team sports. We see a lot of youth athletes involved in school activities. Unfortunately, within our team sports, we see many conflictions with other teammates as well as the opposing team, causing traumatic injuries. However, there were still quite a number of overuse injuries within these athletes. And the big deal with the overuse injuries is that can be prevented, and it's due part on the athlete and the coach to make sure that they're getting the proper treatment as far as warm-up, conditioning, and weight bearing goes, considering that the athlete is just beginning to set boundaries for their body type, and it's kind of the coach's responsibility to say, this is too much weight for you, are you feeling pain, can we take it down a notch? Or, you're not seeing results here, can we take it up a little bit? What I found in my age group category of 30 and over was that there were many overuse injuries, considering adults aren't going to be playing the competitive team sports that our adolescents do. But with the adults, I found that their injuries are typically preventable through different warm-ups, boundaries, and setting body limits for themselves, stabilization, which is finding your center of gravity, and strengthening, which is adding resistance onto that center of gravity. The American Heart Association claims that 83% of Americans do suffer from or do lead sedentary jobs. And unfortunately, this brings us to the idea of the weekend warrior. This is adults who are sitting at their desk jobs, slunched over at their computers, 9 to 5, 5 days a week. Eventually, they start experiencing lower back pain, which is when they're exerting too much force onto their lumbar spine when they're hunched over the computer. And when they decide to go out and play with their kids or go to hit the gym on the weekend, they're overexerting the muscles that they hadn't properly conditioned the week before. So there are many preventative techniques that these adults as well as adolescents can take, which include stretching, whether it be static, which is in place, or dynamic, which is moving, as well as different conditioning mechanisms, whether it be just doing a few burpees or push-ups or just really crunches, and that's exerting your force of your body over excessive amounts of force, which increases stabilization and endurance as well as stamina. From there, you can increase the weight, and with that, there's proper weight training, and that's just gradually increasing the resistance that you're lifting or squatting. And with this, I would advise to avoid rapidly increasing the weight, as this could lead to a muscle tear or a tendon tear. Also, I would advise just to recognize your body limits, because if we say are 100 pounds and we try to bench a 200-pound bar, then we're more than likely going to get crushed, which is unfortunate. But I did establish some plans for my final product within my research, which includes an educational component, which would be informing the public about the different injuries. I decided that I would have a preventative mechanism, which is illustrating a need for these athletes to take proper precautions, as well as treatment, which would provide a set of exercises and stretches that would decrease the resistance they're putting on their body, as well as help them recover from their injuries faster. So within this, I wanted to pick a handful of injuries, whether that be from what Fox News accredits as the top 10, or just some of the prominent ones I found within my research. And I will eventually create a program that encompasses all these aspects. Sports injuries should not take over our athletic involvement. America is very involved with sports, very involved with teamwork, so we shouldn't let them limit us. However, we can reduce America's sports statistics, which is very much needed. Some mentorship updates that I have are that I've been working with Dr. Piotrowski over at Edge Physical Therapy. When I first got there, I was a little bit shy. I didn't really know the ropes there, but she had me dive straight in by learning the different exercises as well as just what the fundamentals of Edge Physical Therapy were. My second day there, she had me go complete a list of exercises that she typically has her patients do, because she feels as though the best way to explain to the patients how to do it is to do it properly yourself first. Also, my second day there, they put me in an AlterG treadmill, which is an anti-gravity treadmill, and they zip you in, and the air inflates beneath you, and it can decrease a certain percentage of your body weight, and so it literally feels like you're running on the moon. But they do use it for therapy, not just playing around. I also experience getting to have more responsibilities, which is what I'm typically doing right now. I go work with the patients on their exercises, which is especially fun when little kids come in and they're so excited about this gym and the different things around. They go do stabilization exercises or just playing around with the weights. So that's always a blast playing with them. But I have been working with some modalities, such as an ultrasound machine, which isn't the one that you use to look at the babies with inside the womb. This one is actually therapeutic, in which it sends sound waves into a tissue, and it massages the cells at a cellular level and gets them stimulating, which relieves some of the discomfort that the patient experiences. I've also used an e-stim machine, which simulates contractions and relaxations within the muscle, and it basically is retraining the brain to say, there's a muscle there, this is how I can use it. I've seen various forms of rehabilitation, such as mobilization to manipulation and other soft tissue work, different exercises and stretches that they give the patients to either take home or do within the facility, as well as the different modalities and equipment, which are the little gadgets around the office. I'm always going around thinking, oh, what does that do? And then a few sessions later, I'll see her use it, and I'll be like, oh, so it does this. Also, it's just so rewarding watching the patients, really improve. I was interested in physical therapy from the start because I get to make a difference in people's lives, and seeing people come a few sessions and then completely regain mobility in their arm, or whether it just be 50 degrees, and it's so rewarding seeing the light on their face saying, oh, I can pull my hair back actually rather than I can go to here. So my SMART goals for this year include some short-term ones, which go up until the end of the semester, and these would be to create my exercise program final product by May, as well as, I've been studying really hard for my certified personal trainer, and I hope to take the exam sometime in June. Hopefully I will have it by August, depending on if I pass or not. And this is a big deal for me, well, partly because I've been studying so hard, but also because I've always had a love for fitness and a passion for really improving the health of others. So this makes a big difference in the fact that I can start my improving others' lives as early on as possible. Some midterm goals that I have include acceptance into a doctorate of physical therapy program. I know that this is a very competitive field, and so the fact that I have such a high goal of getting accepted into one of these programs it's going to be difficult for me. But, however, I will work hard to get into one of these fields and one of these programs, hopefully right after my senior year of college, because I'm not necessarily looking for a certain place, but how fast can I get out of here and start changing people's lives. Another one of my midterm goals would be for me to end this year with about 75 hours of observation over at Edge Physical Therapy, give or take. But I want to go into graduate school with at least 200 hours. And I'm not necessarily looking for the quantity, but I'm looking for the quality. I'm over at an outpatient facility right now, but I also want to experience inpatient, as well as the different specializations, whether it be cardiopulmonary, home health, women's health, pediatrics, or just sports. I also hope to work as a personal trainer, whether that be through the Student Rec Center over at Texas Tech or further on in my career, because again, making a difference in people's lives is something that I'm going to take with me forever. A long-term goal of mine includes me holding a job as a physical therapist by the age of 27, and I'm not sure how realistic or unrealistic this is going to be because I'm so young right now, and I know I have so much experience so far, but there's really no way of knowing because there are 22-year-olds over at the PT place that I work at right now who haven't gotten accepted, and their actual technicians are hired by the PT places. The last goal of mine would be to get my sports or pediatrics board specialty certification, considering I came into this year thinking sports, all I want to be is a sports physical therapist. But after working with a few of the kids over at Edge Physical Therapy, I have really decided that I love working with their fun personalities or playing around with them. So I think that pediatrics might be an option for me. But either way, I know that I want to get my board specialty in something because it shows that I've taken my career a level further and thought about what comes next. How can I make myself better? So I want to end with my quote this year. And Napoleon Hill once said that the starting point of all achievement is desire. Now what this means to me is that I live, eat, breathe, and sleep personal fitness and just overall health. And I think what Napoleon Hill was trying to say is that if you don't try everything you can to make yourself the best, then you're going to come into second place with somebody who wants it more than you. And that has been probably the ISM motto, as I can assume for all of you, is that you really want to take yourself a level further than the rest. And this just has been the foundation of my year, and I hope y'all learned a little bit about sports injuries through my presentation, and thank you. So sports injuries are, again, a really big cause in America because if we don't take the proper precautions and our athletic involvement, then we're going to fall short and we're going to get injured like the rest. Unfortunately, we do see a lot of coaches pushing their athletes to really strive to be the best and push them to be as competitive as possible. And unfortunately, this does cause a lot of stress on the athlete as well as injury that they could sustain possibly. And unfortunately, in America, we do see a lot of competition, but as long as we're willing to make the change and say, I can take these different mechanisms and I can take prevention as well as I know what this topic is, I know what this injury is, and I can make it better. So again, through warming up, conditioning, and proper weight bearing, we can definitely see results altogether in America. So thank y'all for my presentation.